Right. Okay. So we've got Dan turned over. So I've just finished with his glutes, his QL. We're just assessing his hip, obviously. I was assuming his TFL was going to be pretty tight, but it's not. Got the adductors, so we're going to go adductor magnus, my friend, the magnus. So obviously, for those of you that aren't familiar with the hip protocol, we obviously have the masterclass, so it's absolute game changer. But I'm not going to go into the big spiel about it. But if you want to check it out, it's a whole technique and protocol, and a big part of it is adductor magnus, which obviously is the opposing muscle to our glute med. So if we've got issues with our glute med, make sure you're treating your adductor magnus. Very, very important. So let's just free yours up a little bit, Dan. Let's see how it's coping. All right, so I've got the foot over pretty much my TFL. I'm going to support and stabilize his knee here, and then obviously going to work through this area. But while I do that, I'm going to take him into a bit of abduction and hip flexion at the same time. So we'll just do one sweep first. And that's comfortable. That pressure's all right. Let's get this. Yep. Yep. So your restriction's up high, mate. Sorry. So it's all up in this area. You're all right with that?
Yeah.
You sure?
Yeah.
I'm mindful of sensitivity. Yep, all the way up. We'll do 2 more sweeps, mate, and then we'll just recheck it. Don't have to belt this muscle. Beauty. All right? Yep. How's that now, Dan? I mean, I can feel it, but I mean, what about you?
Yeah. Feeling a lot, probably more in the joint.
Yeah.
And probably feeling more in the TFL now.
Yeah. Well, I'm going there, mate. So TFL it is, ladies and gentlemen. Right. So this is my preferred way of working TFL, just because you get fairly good access to it, and I can get a bit of passive range again through it. So I'm just using like a loose fist. So I'm going to work all the way up, pretty much to the top of the iliac crest, the ASISE area. That's where the biting part of it is. Well, that's where that trigger point lies too as well. Now, remember, we're just doing this. This is generally just to try and free you up. Do you know what I mean? This is not about treating an injury. It's not about, like if, let's say, for instance, God forbid you were a runner, we'd be doing this on a regular basis just to keep stuff free, no niggles to worm their way in. Yep, good. Oh, yeah, wow. Yeah, that's good. I'm loving that. That's great. Yep, terrific. All righty. So, Dan, I'm pretty happy with where we're at there. So, do you mind? Can you sit up for us? And I just want to check your rotation and everything else afterwards. I know we don't have much to go on in terms of, oh shit, yes, I had pain on this range and all that sort of stuff. But let's just let's get you into rotation, neck rotation. So go to your left for us. Okay. And to the right. Beautiful. How's that feel for you?
Freer.
Yeah. Oh, well, of course it's going to feel freer. There's no doubt about it. So the beauty is that tone's down now, especially that first rib too, which is good. But, you'll go out in clinic and you'll load that all back up again.
Yeah, very good.
Yeah. Absolutely. Righto. Let's now have a look at your lateral flexion. Good. Yep. How's that feeling there now, buddy?
Like it goes into that.
Yeah. So it's not feeling uncomfortable?
No. But
Good.
little clicky, but
Yeah. Chin to chest. Yeah, that was pretty good anyway, wasn't it?
Yeah.
Yeah, that was good. Come back up for us. No dramas. Hands over the chest. Let's go to our rotation again. Let's just see how that is.
yeah, that
Yep.
feels much better.
And go that way. Yeah, that's a little bit more even, isn't it? Yeah. Right. Let's just check this lower back situation. Yeah, that's good. Okay. I would possibly do a couple of more treatments on that, mate, to be honest. But that is definitely better. And yeah, those glute. You just need to get in there and do some work on that glute as well, mate.
Yeah.
Probably with a bit of tennis ball action or whatever the case may be. Yeah, good. Yep, no worries. Just one thing that I haven't tested before. Arms behind your head. Doing like this. Let's just see what your extension's like. Oh, nice, Dan. Yeah, that's good. You're good. Thoracic extension. You do much of a thoracic extension?
I arch my back as often as I can.
Yeah, do. Oh, that's there you go, ladies and gentlemen. You arch your back as much as you can. Wonderful. All right, guys, that's about it for me. So just a bit of an overview. Obviously, clients coming in not necessarily with anything specific. Where do you go to? What do you check? That's pretty much of a broad thing that I do. Obviously, Dan being a therapist himself, I sort of already know what he's probably going to come in with a little bit, but you just never know. Anyway, guys, be awesome at what you do.